Hi everyone, this is Dr. Shabri Hasood, the GP from Southwest of England and also the Medical Director of Adisha Health. Thank you for all the love and engagement to the vitamin D supplementation to prevent deficiency video which I made last time. A lot of you got back to me and said, what about vitamin D deficiency? Because we had lots of vague symptoms. It took a long time for us to think it could be the cause. Go to a GP, get the right blood test done, be on the right treatment and feel better again. You guessed it right. So we are going to be talking about vitamin D deficiency today, signs and symptoms, how to diagnose it, and the treatment. So coming to vitamin D deficiency in adults, how common is it? 1 in 5 adults in the UK have got vitamin D deficiency. That is 20% of the adult population, 20% of the adult population. Vitamin D is a fat-soluble vitamin which is responsible for good bone, teeth, and muscle health. It regulates the calcium and the phosphate levels in the body. 80 to 90% of it is produced in the skin in the UK with the help of sunlight. Very small amount, that is 10 to 20% of it is present in some food items like liver, egg yolk, red meat, oily fishes like salmon, mackerel, sardines, etc., and some fortified foods. So, what are the risk factors to develop vitamin D deficiency? Now, either you're not exposed enough to the sunlight or you have not have the skin type where it is producing enough. So, all ethnic minority in UK are at risk, like all BME population. If you're older than 65 years of age, you're between 1 to 4 years of age, or if your skin is not exposed to the sunlight much, for example, if you keep your skin closed because of religious reasons, or you're housebound, or you're, for example, you're in care home or nursing home, if you have any liver or kidney disease, because liver and kidney functioning normally is also very important for normal levels of vitamin D in the body. Now, I just want to highlight, when I was doing the research for this video, I found obesity is also a risk factor for vitamin D deficiency. So obesity is a risk factor for vitamin D deficiency. Coming to the signs and symptoms of vitamin D deficiency, it normally affects the bone health, the role of the vitamin D in other things like immunity, mental health disorders, including Alzheimer's disease, diabetes, cardiovascular disease, breast cancer, breast tumor, and recently the COVID infection is less evidence, but there is some importance of it, because especially during the first wave, they found that people who were admitted with severe COVID infection had vitamin D deficiency. Osteomalacia is the common presentation in general practice. People say they've got back pain, pain in their shoulders, ribs, pelvis, legs, muscles. They feel the muscles are weak and they can have waddling gait. They might have difficulty going up the stairs. I remember one of my patient, actually she was a Caucasian who was 46 during pandemic, who came and said, since the last couple of years, doctor, my legs are just not doing what I want them to do. I can't believe, I just feel it's weak. And now of late, I find it really hard to do my stairs. So because she was not in the risk group, people were not thinking in those lines, but I did get the vitamin D levels done to find out that she was deficient. We started the treatment. It took her a while, about 6 months to a year, to get back to her baseline. But the good thing is the prognosis is, it is good once you find out. The other thing that can happen in vitamin D deficiency is osteoporosis or thin bones, which can cause low trauma fractures, mainly in the wrist, spine, and hip fracture is very, very common. So how do you diagnose vitamin D deficiency? It is through the help of just a simple non-fasting blood test. If your vitamin D level is less than 25 nanomoles per liter, then you're deficient. Insufficient levels are between 25 to 50 nanomoles per liter, and sufficient vitamin D is more than 50 nanomoles per liter. How do you treat? So if we find that you're deficient, you have to treat promptly with weekly loading dose over 7 weeks. It is normally between 6 to 10 weeks, but here it is done as a standard of 7 weeks with nearly 300,000 units orally or with an injection. We do in NHS normally orally, and then followed by you're supposed to have a maintenance dose of 1,000 to 2,000 units daily. After you've done the loading dose for 4 weeks, you need to have a blood test to see what are your calcium levels, because sometimes your calcium levels can go up when you're loading the vitamin D. If it is insufficient, then you need maintenance dose of 1000 to 2000 units daily. If you've got sufficient levels, then just maintain it with, goods and exposure or safes and exposure, diet, exercise, over-the-counter vitamin D supplements during autumn and winter if you belong to the risk group, throughout the year, which was there in my previous video. But the good news is the prognosis is really good, which means that if you start taking vitamin D, once you're diagnosed, it will take a little bit of time, but you will start feeling better. Your muscles, bone will become stronger and go back to their baseline. Now, please like, share, and subscribe, because it is really important that we spread the evidence-based knowledge. And thank you for listening. I hope you all are taking the vitamin D, because it is autumn in UK.